You're here because you're scared and desperate to help your child. This is your guide to practical steps. But what if your most loving actions, paying bills, making excuses, are preventing their recovery? This is enabling. It feels like helping, but it actually prolongs the addiction. The solution isn't to love less. It's to help more effectively by understanding the real problem. We will now break down the science, show you how to stop enabling, and give you strategies for today. First, understand this. Addiction is not a moral failing. It is a recognized chronic brain disorder. This is especially dangerous for teens, as their brains are still developing. The prefrontal cortex isn't mature until the mid-20s. This means their brains can develop an addiction faster and be damaged more easily than an adult brain. Because of this vulnerability, catching problems early is one of the most powerful things you can do. Early treatment improves outcomes. So if addiction is a brain disease and early action is key, what do you actually do? It starts with changing how you communicate. The goal is open and assertive talk, not lectures. This is strategic to keep communication lines open so you can spot problems. Instead of, "You're ruining your life," try, "I'm worried about you, and I've noticed this specific behavior. Can we talk?" But how do you prevent problems from starting? There's one conversation that research shows can cut substance use risk in half. We'll reveal it shortly. Beyond talking, your most powerful tool is setting and holding firm boundaries. This is where helping ends and enabling begins. Establish clear, consistent, and immediate consequences for substance use. This allows them to feel the results of their actions. Your child doesn't need a cool parent. They need a guide to hold them accountable and provide the structure they cannot. So what does this look like day to day? Here are 3 strategies you can implement right away. 1. Practice refusal skills. Role-play situations and give them pre-planned lines like, "No thanks, I have a game tomorrow." 2. Create an escape plan. Agree on a secret code word or emoji they can text you for an immediate, no questions asked pickup. 3. Support healthy activities. Help them engage in sports, music, or volunteering. Anything that gives them a sense of belonging. These tools are powerful, but they only work if you are part of a larger support system. Let's talk about managing your own role. Dealing with a child's addiction is incredibly isolating. Many parents feel judged by friends and stop reaching out for help. You cannot do this alone. Finding support groups or therapy for yourself isn't selfish. It is necessary for your own survival. Another complexity is your own behavior. Research shows children of parents who misuse substances are at a much greater risk themselves. Your actions send a powerful message. Modeling responsible behavior is non-negotiable and gives you clear authority to set boundaries. Finally, addiction affects the entire family system. This is why family therapy is often recommended to heal communication patterns. Okay, let's put all the pieces together. We've covered brain science, the trap of enabling, and practical strategies. How does it all connect? We asked if your love could be a barrier, then showed how addiction hijacks the brain. This is why boundaries are science-backed compassion. And that conversation that cuts risk by 50%? It's talking to them about the specific risks of drugs and alcohol. That's the single most effective tool. Prevention, communication, and boundaries all work together. Carving out family time builds the trust needed for tough conversations. The shift is from feeling like a helpless victim to being an active, empowered agent in their recovery. You have power, so use it wisely. Helping your child through addiction is not impossible. By understanding the science and shifting from enabling to empowering, you can help. Recovery is a long road, for them and for you. There will be setbacks. But recovery is possible, and your healthy involvement is a critical piece. If you're overwhelmed and don't know where to start, do this one thing today. Find a support group for yourself. Put your own oxygen mask on first. You are not alone. You have a community, and you have a path forward. It is time to take the first step.